Organising your practice to deliver the mental health enhanced service. There are several tips for creating the most efficient system to deliver the service smoothly in your practice. We will cover the following areas: creating caseloads from the QOF SMI register and for complex common patients, the recall system, pre-filling the questionnaires, and staffing structure for delivering appointments. Creating caseloads for the QOF SMI register and complex common patients. The service includes all patients who are on the QOF SMI register, and also the top 10% by severity of the complex common patients in your practice. These complex common patients are included so that patients with severe illness and who may be on antipsychotic medication can also receive this service even if they do not have an SMI diagnosis. The service requires that 80% of the QOF SMI patients are seen per year to ensure priority coverage for this particularly vulnerable group in line with national guidance. The new Whole Systems Integrated Care Mental Health Dashboard Finance section is available to help monitor progress against completing these checks. It lists each item from the minimum data set on the template and the boxes that need to be ticked to confirm completion of the checks. They show red at the start of the financial year, automatically turning to green once each item is completed. Please note the GP data feed to the Whole Systems dashboard is weekly, so it may take up to a week for these to update after data is entered. All QOF SMI patients will automatically appear in the dashboard. Complex common mental health patients will appear once any part of the template has been completed. Complex common patients may be added to the service on an ad hoc basis through case finding during consultations or through searches of the practice system, such as for specific diagnostic groups, relevant medications, or frequent attenders. The recall system. It's recommended that practices operate a proactive recall system to ensure eligible patients are seen for these checks. This can be effectively achieved by practice admin teams using the Whole System dashboard's lists for reference. Patients can be invited for appointments by letter or by phone call, as is most convenient, though please be aware that some of these patients may require several reminders before they book an appointment, as this is the nature of their condition. Pre-filling questionnaires by post or in reception. Some practices have sent the SWEMWeb's questionnaire to patients in advance of their appointment to be pre-filled or ask them to complete it on their arrival at reception. The data can then be added to the template prior to or during their appointment. In other circumstances, patients may require support to complete the questionnaire, such as when English is not their first language or there are literacy challenges, and it may be more appropriate to complete the questionnaire with staff support. Please remember to be diplomatic in offering this support, as most patients are very reluctant to admit to illiteracy. Staffing structure for delivering appointments. Greatest efficiency can be achieved by inviting patients for 2 appointments for their annual review. The first should be with a practice nurse or suitably qualified healthcare assistant to complete page 2, the minimum data set. The second appointment, preferably a week or 2 later to allow for results to be available, should be with the GP to complete page 3 of the template, the annual review. Further follow-up consultations with the GP can be completed on an ad hoc basis or by invitation as required, approximately once every 6 months. Please note, healthcare assistants are not permitted to complete the alcohol and social questions on the minimum data set unless they have specific training in doing so, such as that provided around care planning.